Hello, this is Bob Rubin again. Terry Cole has asked me to do another video where I talk about the scientific viewpoint on what we can expect from the COVID-19 pandemic in the United States going forward from this time. And so I'm going to give him my considered opinion. So I'll start out with comparing this pandemic to the common seasonal flu. COVID is about 4 to 10 times more deadly and up to twice as infectious as common seasonal flu. We still have regular seasonal flu occurring on top of the COVID epidemic. And each year, from 9 to 60 million Americans get sick from flu each year. And about 0.1% of those people pass away from the flu. Like COVID, the people that tend to die are the very old and people with underlying serious medical conditions. But also like COVID, young people and middle-aged people die as well. And so it's a more serious problem in many ways. And the current evidence suggests that in terms of infectiousness, the flu is maybe as much as COVID is as much as twice as infectious as the flu. So it's a more infectious agent and much more deadly. Current social distancing, isolating contacts of positive people, staying at home, no group gatherings, and mask-wearing methodology is working to greatly reduce the spread of the virus. There's no question about that. The more vigorous the enforcement of this mix of behaviors, the less the virus is going to spread, or at least the less the rate of spread will be. We're a long way from completely tracking all infectious people and isolating their contacts. We're doing a very bad job of that nationally. And many places are not being rigorous in enforcing the other behaviors I mentioned. Other coronaviruses that have been studied over the years are seasonal, and we might expect some further reductions in infections as the summer progresses, and then these will pick up again in November, December. But given everything I've just said, we can expect to see continued infections in the United States, all over the United States, for years to come. Now, the next topic I have is herd immunity. You probably heard a lot about that. Pandemics in general end when enough of the population, usually 70 to 90% of the population, get infected or immunized with a vaccine. The virus appears relatively stable, so we think, although we're not absolutely sure, that once infected or immunized with a vaccine, you will be immune for years, possibly for life. When this happens to 70 to 90% of the population, the pandemic ends, and we say the population has herd immunity. Next question. When will a vaccine be ready for mass immunizations? It's a tough one to answer. My best guess is not for 2 to 4 years, most likely. We probably already have a vaccine that will work. Since there are over 50 lab efforts underway around the world to develop a vaccine, there are many different approaches. As far as I can see, all of them are rational, and many of them will probably prove effective. The problem is we don't know which will work and which won't. And in some cases, past history has shown that some vaccines actually make a person sicker, can make the situation much worse. And so we have to test each of these vaccines first on animal models humanely, and then humanely, hopefully, on people. And this takes time. Once we find a few that appear to work, then we've got to figure out how to make hundreds of millions of doses all at once to immunize an entire nation like the United States. We would need between 250 and 500 million doses of such a vaccine, probably have to be given twice, to get herd immunity in the United States through a vaccine. And that's a big problem. We do not currently have the production capability in the United States to undertake that kind of endeavor. It doesn't, by the way, exist in the world to produce enough vaccine to immunize the world. So this is a big problem. Even if we took all the capacity in the United States for vaccine production and devoted it for the production of the selected vaccine or vaccines that we've shown work, that would take all other drug production out of the cycle of the production for the country, and many people would die because they couldn't get their normal medications. So it's going to take a Herculean effort to gear up the manufacturing capability in this country or around the world, or with our partners around the world, to produce enough vaccine to actually produce herd immunity in a reasonably short period of time. And that's if we're very lucky. It's possible that I'm wrong and that that none of these vaccines will be effective. Given what I know about previous vaccine work in this type of virus, I'm mildly optimistic that we'll find one that's effective. But it's not going to happen rapidly, and we're going to be around this virus for a number of years. I'm guessing 2 to 4. What about a treatment? Well, many new therapeutic efforts are underway around the world. Most of these drugs and therapeutic approaches focus on the very sick. Although some of these may prove useful, it's unlikely that the treatments will affect the course of the pandemic because they're being used even now on very sick people who've already caught the disease and are already taking up hospital beds and ventilators and the rest. A possible exception might be drugs like remdesivir that interrupt viral replication. And if we ever got, which we do not now have, adequate testing, you could envision a situation where we might be able to interrupt the progression of the virus in every individual as soon as they're infected. If we had adequate testing, you give them a drug, you interrupt the infection, your body clears it, you never get in the hospital, you become a statistic, but not a bad one. This is possible, and there are a lot of people working on therapeutics that can do this. Although this wouldn't affect the overall infectivity of the United States, it would dramatically reduce the effect of the virus on the economy and in the healthcare system. Unfortunately, you still have the problem of how are you going to produce hundreds of millions of doses of such a therapeutic. And there you may imagine a situation where you may have to give it numerous times over a few weeks to stop the infection from progressing. And again, you're talking about hundreds and hundreds of millions of doses, and the production facilities do not now exist. What about testing? What's the story about testing in the United States? Well, it's pretty clear that the country is completely inadequately serviced by testing infrastructure. The government has completely failed to plan for, produce, and deploy the many millions of tests of the virus that are needed to rationally approach the legal and economic and behavioral dictates that society needs to entertain to control the spread of the virus. We just don't have it. The numbers aren't there. They've never been there. It's estimated that we need 3 to 10 times more tests available throughout the country to adequately monitor the advance of the virus, the effect of all of these behavioral modifications, and the restriction of viral transmission because of these policies. And without adequate testing, you don't really know when you can let up and open up the economy because you just don't have the numbers. A surrogate for appropriate testing that's being used today is a figure like the number of deaths per 10,000 people. At the 100-foot level, you could say, well, a city or a state might evaluate their progression of disease by monitoring how many people are dying throughout the state or the city, and do the math in terms of the number of people that are present, and get some feel for whether or not their policies are being effective. And of course, you can use that kind of information to determine how overwhelmed your healthcare system is, and that can be a surrogate number that municipalities and states and the country as a whole, for that matter, could use to regulate when they let up on these restrictions and open up the economy somewhat. Next question. So what can we expect over the next 2 to 4 years? Well, we're obviously going to be living with this virus for a long time. We can expect to have waves of infections that come and go as we institute all or many of the behaviors that are working now that I already mentioned. The goal is to get herd immunity of 70 to 90% of the population immune. And this is going to happen by 2 ways. 1, people getting infected and surviving. And 2, hopefully, eventually, a viable vaccine. And in the meantime, we're going to be restricted in our economic activity in our daily lives. Eventually, a vaccine will be produced. I believe that. And in combination with the normal rate of spread of the virus, the 2 will get us to herd immunity. I'm guessing 2 to 4 years. Recent data out of New York State suggests that somewhere between 10 and 20% of the population is already infected. So it's spreading, and the actual rate of infection is clearly 5 to 10 times what our measured rate of infection is. So we're getting lots and lots of people infected who don't get really very sick. They get a little bit sick, or they don't even know that they've been infected. So we're slowly climbing the ladder to herd immunity. But if we wait for it to occur naturally at the current rate, it'll be many, many years before we get there. So we're hoping for a vaccine, and the 2 processes would meet in the middle. So this is my assessment of where we are. I don't really feel like this is a very positive message for the economy. But it need not be as catastrophic as it is today. I think we can have something in between where the economy opens up, but slowly, and we monitor the spread of the virus and ratchet down the economy when it's spreading in one place and open it up where it's not spreading as much elsewhere. And this way get through the next 2 to 4 years until we've reached this immune plateau of herd immunity. Thank you.